Okay, I guess we're live. Tansy, and good evening, everyone. My name is Janet Smylie, and I am here with my friend and colleague, Suzanne Shoush. We are both family doctors, and we're going to chat tonight about vaccination. And in particular, what we want to do tonight is talk specifically about the Pfizer vaccine. And go through the consent form for Ontario too, because we're working together on some vaccination clinics at the Auduzhe Centre. So just in case people don't know me, Tansy Nene, Janet Smylie Tansine Kassan. I'm a Métis family doctor, mom of 6, grandma of 3. And I also do quite a bit of work in public health and research. And I am a partner in the Auduzhe Clinic, the place for healthy breathing that we set up with 7 Generation Midwives Toronto and NAMI Res, or Native Men's Residents here in Toronto. And we have been trying to provide some wraparound community supports for First Nations, Inuit, and Métis here in Toronto since October. And for the past couple weeks, we have been also trying to support our community here in Toronto in accessing immunization. And I will turn it over to Suzanne Shoush so she can introduce herself, and then we're going to talk a little bit about the Pfizer vaccine.
Thank you so much, Janet, and hello, everybody. I wish I could see your faces to see who's here. I'm Suzanne Shoush. I am also a family doctor. I am a very close friend and colleague and sister of Janet. I'm very honored to be here today to talk about this vaccine and the vaccine rollout and the prioritization of our community and how important that is. Vaccination, again, is a choice for everybody. So this is just a question and answer. If there's anything that you want to know, that you want to ask, whether you're ready for the vaccine or not. I myself am also a mother. I have 3 sons. My mother is First Nations from Coast Salish, from British Columbia, and my father is from North Africa and Sudan. And I've been living in Toronto for the past few years after living a long time in Northern Ontario with my family. So it's very nice to be back. It's incredible to be part of this Auduzhe Mino Nesewinong vaccination clinic. And I look forward to answering questions with Janet. So thank you.
So what I tend to do to start out is one of the things is that there's a lot of information everywhere about vaccines. So Suzanne and I are here just to try to explain some things, provide some factual information so you can have full and informed choice and consent about the vaccine. So basically, if you are considering getting a COVID vaccine, and you do go to a vaccine clinic in Ontario, they're going to ask you to sign a consent form. And for those of you that are coming into Auduzhe Mino Nesewinong, the place for healthy breathing for your vaccination, we try to share information about the vaccine in advance so you can think about that, and even if you can, get you to review the consent form in advance. So then that way we can always double check your decision when you come in, but we can offer more people the vaccine because we have 80,000 people here in Toronto. So it's a lot of vaccines to give. So the first thing I'd like to talk a little bit about is for Pfizer, biotech, and also the Moderna COVID-19 vaccine. Some of you have heard that these vaccines are based on a technology called mRNA, or messenger RNA. So right off the bat, that can make people very nervous because a lot of people know that DNA is our sacred instructions, and we need to be very careful about our DNA. If your DNA gets damaged, you can get cancer, that can get passed along. There's epigenetic damage. So the first thing that I think is important is to clarify that messenger RNA is made by DNA. It's a code, it's a protein, but messenger RNA cannot make DNA or harm DNA. So the other thing that I think is important for both the Pfizer and the Moderna vaccine is they don't contain COVID virus. They don't contain any virus. They don't contain, so some vaccines have like a virus that has been weakened. But then people get scared because they think, oh, that virus could change inside me and get strong again. So the Pfizer and the biotech and the Moderna vaccine basically just have a little piece of code called messenger RNA. What the messenger RNA does, what messenger RNA does in our body, so DNA makes RNA and RNA makes proteins. So this messenger RNA makes a protein, it makes a very special protein. It makes a spike protein, which is actually the signpost or the spike on the COVID vaccine. And then when the messenger RNA makes that protein, your body says, oh, I've not seen that protein before. So you have no COVID in your body from the vaccine. You just have the messenger RNA that causes your body to make a protein. When the whole vaccine process is done, you just pee out the messenger RNA and the COVID spike protein. But before that happens, because the protein isn't a regular protein in your body, the body sees it and it says, this isn't part of me, I better get rid of it. So it stimulates our immune system. So then the immune system, the cells see it, and the B cells start making antibodies, and the T cells and some of the other cells start reproducing. So you get these special warrior cells, and they now know the COVID vaccine spike protein. And it's a good protein for the body to be able to get rid of, break down, or make not work anymore, because the spike protein is actually how the COVID gets into your cells if you do get exposed to COVID. So basically how the COVID-19 vaccine works is it basically sends in your body a bit of a code protein called messenger RNA, which makes another protein, which is the spike protein, which stimulates your body to have an immune response to that protein, a specialized immune response. So then your body's all ready in case you get exposed to COVID. Suzanne, did I explain that? Do you want to add anything or make it clear?
Yeah, I think that's a really good explanation. And I see that was coincides perfectly with a question that just came in about when did scientists start researching and working on mRNA? So like Janet said, we've known about mRNA for a very long time. The type of immunization in the mRNA vaccines is not new technology. It's new for vaccine technology, but it is not new in healthcare. So people have been using this type of mRNA technology and immunotherapy for things like cancer for more than 15 years. And when this new pandemic started, the people who had been working with mRNA for more than almost 2 decades really immediately knew that they were going to be able to use their mRNA technology to make a vaccine. And it's exactly like Janet said, the vaccine has a spike. It uses that spike like a key to enter your cell. The virus needs to go inside of your cell so it can replicate itself. So
The virus has a spike, not the vaccine.
Sorry, the
right,
virus.
Suzanne? Yeah.
The virus has a spike. It needs to come inside your cell to replicate itself. Because like everything else, a living organism is the virus, and it wants to stay alive and it wants to replicate itself as much as possible. So it uses its little spike key to get into your cell. And exactly what Janet said is that the vaccine gives you instructions to alert your immune system to create antibodies against the spike. So it's like taking away the key so it can't get in your cell. And that's what's really important about it. So it is, it's been used for a very long time. We haven't seen alterations to DNA or to children or anything like that. It's shown to be really incredibly promising and really effective and extremely powerful technology. And I think that we'll probably see a shift in our coming vaccines towards mRNA vaccination, especially like Janet said, because it does not include any virus in it and it doesn't give you the risk of making you unwell with the virus.
Yeah. So again, it's up to everybody, but if I thought about a vaccine for me, I like the idea that it's using this clean technology. I was nervous, and I think a lot of people are nervous out there. They're like, well, but we've only used this for a year in vaccines. But then I was doing a session like this with Suzanne. We were right in NAMI Res talking to some of the residents there. And then that's when she told me, oh, but they've used it in cancer treatments for over a decade. So then remember I said I also do a lot of research. So then I just went home and looked on my laptop and looked at all the studies that were talking about using this messenger RNA technology in cancer treatment. And there was no outstanding significant long-term side effects. So it has been in use in cancer treatments. So as far as we can tell, and it's been used for 10 to 15 years, there's no significant outstanding long-term side effects from messenger RNA technologies to stimulate the immune system. They've been used in cancer treatments in a similar way, but they would probably have the messenger RNA have the code for some funny protein that's on a cancer cell to alert the body, and then the body would become able to identify and get rid of the cancer cells. So that's also pretty good. So of course, when people ask me, what are the long-term side effects of the Pfizer vaccine? We don't know because we've had it for less than a year, but we do know the same technology has been used for 10 to 15 years. And we do know that there's no virus in it. And we do know that it's a pretty clean technology. Of course, all vaccines stimulate the immune system, but our immune systems get stimulated every day because it's not only through vaccination that we get things in our body. They get stimulated every day when we get exposed to other viruses and bacteria, or when we get a splinter. Anyways, those things make me actually feel pretty good about the Pfizer and biotech vaccines. Another important question is who can get the vaccine and who can't. So basically, people who are over the age of 16 can get the vaccine. You have to wait until it's your time, though of course First Nations, Inuit, and Métis adults in Ontario are a phase 1 priority group. If you're under the age of 16, you can't get the vaccine yet because we don't do vaccine trials on youth or children. And then is there accessibility to the list of ingredients of the vaccine? And yes, there is. And that's a great question because on the consent form, it says what's in the vaccine. The thing that's interesting is this is the 10-page little printout from the Ministry of Health, and I'll put it up there. The list of ingredients seems like a science experiment, right? Like, so even for me, with advanced science training, like a lot of chemicals, it can make people nervous. But remember, even our plant medicines have many components and proteins in them that will have long names. But basically, there's one of the ingredients that you hear a lot about is polyethylene glycol. So the most serious short-term side effect from the Pfizer and biotech vaccine is allergic reaction, an immediate allergic reaction that would happen within 15 or 20 minutes of having the vaccine. So it's kind of like similar, those kind of immediate allergic reactions. Some of you might be allergic to peanuts or bee stings, so you know about that. Fortunately, there's no cross-reactivity for most drug allergies or peanuts or, penicillin allergies. But the one component that people can react to is something called polyethylene glycol. That kind of reaction is actually pretty rare. Suzanne and I have now been immunized in hundreds of people with Pfizer and biotech, and Suzanne also with Moderna in Northern Ontario. So fortunately, none of us have seen that kind of immediate allergic reaction. The good news is actually we could treat that with an EpiPen, but people ask about that polyethylene glycol. When I started, I thought, I know it's in windshield wiper fluid, but I didn't realize it was actually in different skin cosmetics and things like that. So you might be aware, and apparently it's in the coating for gel tabs, like Advil gel tabs. And so I'm going to put, as soon as I stop talking, I'm going to put in the Facebook chat, in the Zoom chat, and then maybe Sam can also put it in the Facebook chat, the link where you can go to the Ministry of Health, and it's on page 5 that they have the ingredients to the Pfizer and biotech vaccine. So basically there's the polyethylene glycol, there's a couple of fats and a couple of salts. But the main one that we worry about is that polyethylene glycol. The other thing is, so the only people who can absolutely not get the COVID vaccine, are people who are allergic to polyethylene glycol, right? Then we would have to have an allergy consult. people who had received another vaccine in the past 14 days, because we want to allow your body to focus on the COVID. And then people who are under the age of 16. There's a whole bunch of other questions on the consent form asking about any immune problems and any problems, like if you're pregnant or breastfeeding, or if you have bleeding disorders. You can still get the vaccine if any of those things if you have any of those things. We just want to talk to you about it. So the issue about why the kids can't get the vaccine yet is just because when we develop vaccines, it's not ethical to test them on children or youth. So those trials are still ongoing, but I think we're going to hear pretty soon about whether it's safe for children and youth. And then we also would want to make sure it was effective. We do know that, COVID operates a little differently. Like, I'm so grateful that actually it doesn't really affect children as severely as it does adults. There's something about the way it works in children's bodies. Their immune systems are a bit different. So we need to see if these vaccines are going to be effective in children as well. Suzanne, you're on, and I'll let me dig up that link for everybody.
Yeah, no, it's a good question. The most straightforward way to get a vaccine out of the lab and into the real world is by just making it as simple as possible. So it really is, the simplest thing is to include nobody who is nursing, nobody who's pregnant, nobody who's immunosuppressed, nobody who is a child. So they just wanted to make it as fast and straightforward as possible, get it out to people with the urgency needed. And they are working on the vaccine for 12 to 15 right now. People who are considered extremely high risk, who are age 12 to 15, would be eligible after a conversation with their doctor. And under 12, we're still just waiting for the evidence. And again, with Moderna, they actually included in their research trials 18 and older. So the young ones will be able to get it soon, but until then, the best thing that we can do is all get our vaccine, or as many people around the children get their vaccination against COVID, and that should start to protect the kids from infection and from spreading it. So it's very good there. And I see that Janet also posted some information.
Yeah, so that's just the post to the actual Ministry of Health sheet, and I'm just going through the whole sheet so that in case you don't feel like reading a 10-page fact sheet. But feel free to have a look at it too. So the next section really, and it really relates to where we're at, what we've been going through, is just about the people that have a bleeding problem. So you just need to let your healthcare provider be aware of that. It's a very small needle with the Pfizer, and it's actually a very small amount of fluid. It's less than 1/3 of 1 cc. So yeah, basically, if somebody was on a blood thinner, the risk is that you could bleed a little bit more, but it's such a small needle, we would just push on your arm a little bit longer. For people who have immune problems, it actually can be important to get vaccinated because you will be more susceptible to COVID. The main reason we want to know about that is some of you might be taking different medicines that suppress your immune system if you've had an organ transplant, or if you have inflammatory arthritis, and we might try to time those medicines with your specialist. You might need a booster shot sooner rather than later. So we just want to know about those things to make sure that we can support your immune system to respond. It's not like other vaccines where there is a live virus, and if you're immunocompromised, then it might be contraindicated because, again, remember, this one's just some proteins. And then again, for people who are breastfeeding and pregnant, as Suzanne mentioned, like, we don't run the vaccine trials on people who are breastfeeding or pregnant. It does look like some of the antibodies from the Pfizer and BioNTech vaccine does get into the breast milk. We don't know how that affects babies, though antibodies are just proteins, and most antibodies that are produced, we're actually happy when it goes into the breast milk, because then the baby gets some of them and they can't always produce their own. The good news is babies actually aren't really that badly affected by COVID. But pregnant people are, because again, the stress of being pregnant. So that's a decision that you want to make with your healthcare providers. But again, Suzanne and I have both vaccinated pregnant people, because the risk of actually getting severely ill with COVID, and you're a little higher risk versus the risk of the vaccine harming your baby. I did a vaccination for somebody who was 6 months pregnant at one of the vaccine clinics I was at. And by that time, the baby's fully formed anyway. So it's hard to imagine that there would be a harm, but there could be a big benefit to preventing the COVID. But again, I'm not a big supporter of large pharmaceutical industries. I'm not trying to convince anybody who's not convinced. If somebody came and just said, well, I'm really nervous and I feel healthy, and I live in a house and I can stay home and away from everybody, then we would just go through and make the decisions that are customized to every individual. I don't know, Suzanne, if you wanted to say anything about those other groups of people that we try to pay particular attention to.
Yeah, definitely. So preliminary papers that are just preprint right now are showing that there is a benefit to the newborn who's nursed post-vaccination. So it shows about just what we would expect, about 7 to 10 days after your vaccination, you start to produce the right antibodies, and those will go into the breast milk to the baby. So that's showing to be protective. I actually worked at from the very beginning of the pandemic at some of the COVID recovery sites, and we were seeing a lot of newborn babies born to COVID positive mothers. And we've also seen that those mothers do pass antibodies to their babies from having COVID. So there is protection, but it definitely is something that you really want to consider. Like Janet said, if you can mask and hand wash and social distance and stay home, you could wait for a little bit longer if you feel really uncomfortable. But it is, there's no reason that we know of at this time that would be a contraindication. It's just something to consider your own comfort level. And what I like to tell people about the blood thinners is that we just need to know, because like big bruises look bad on Facebook. we don't want any bad publicity. No, I'm just joking. But we do just want to make sure that we're doing everything possible to make your experience really pleasant and really healthy and really positive.
And that's why we're happy to be working with other people in the community, and also supporting Anishinaabe Health Toronto that's having large vaccine clinics. If we do this by ourselves, for ourselves, we can build on our existing relationships that we have, and we have some fun. We do some visiting. We have to keep the flow going because, of course, we still all have to mask and social distance. But yeah, so far we do a little ceremony in the morning and send out our prayers and smudge that vaccine, and a little prayer at the end of the day, and lots of visiting. I see some really good questions about carriers, which I'm going to let Suzanne answer in a minute. But before I get there, I just want to follow through this 10-page sheet and cover a little bit more. So basically, the Pfizer vaccine is administered in 2 shots, originally 21 days apart. But again, people have been watching the news and you'll hear about delaying the second dose up to 4 months. We're still trying to figure that out. I'm working with others to try to figure out, well, what would be the best time for the second dose for First Nations, Inuit, and Métis people and communities. And again, we're a pretty diverse lot. I guess I do think that there's some wiggle room for sure to extend the second dose to 6 weeks or 42 days, because people have been following the antibodies. And it really depends where you are. In a big city like Toronto right now, where it looks like we're going to be hitting our 3rd wave in the next couple of weeks, and we have the new variant, I'm pretty anxious to try to get as many people who want vaccinated as soon as possible, particularly those who are living in crowded congregate settings, like big social housing, like high rises, people that don't have the ability to actually control who they're interfacing with, people that have to do direct service work, and our elders. Moderna vaccine, second dose, 4 weeks. So basically what I'm telling people now in our clinic is you'll get your second dose sometime between 3 and 6 weeks. Yeah, we really don't know if you delay all the way out to 4 months. And then again, just because I know in Toronto too, we're a really mobile group of people, I want to make sure that I can find people for that second dose. So basically the first dose is pretty good protection, probably out to 6 to 8 weeks. We don't really know. And on average, maybe even longer. The challenge is that's for average, right? But people who have immune issues, there's some evidence showing that people who are large actually don't generate as much antibodies to start with. So then it's going to be really important to get your second dose. And all of us, even those who are very healthy, will need their second dose for a sustained response because our immune system needs a reminder. Yeah, I see Suzanne, she's got some beautiful kids. If we're lucky, they'll come join us for this session. Yeah, the immune system needs a reminder, and that's what the second shot is about. It's exactly the same as the first shot, but the immune system needs to be reminded, and then you can probably have the antibodies to last for longer. So if you only have one shot, I'd be quite nervous. Just we have no idea in 6 months whether or not you would still have the immune response. So with the 2 shots, we know that the coverage is pretty good. It'll fall. Suzanne, did you want to answer the questions about being a carrier and if we can spread the virus and those ones? Do you see those on the chat?
Sure, those are fantastic questions. And I think that, some people will really wonder about that. So as far as, okay, will the vaccine prevent us from being a carrier of COVID? So the vaccines, the Pfizer and the Moderna vaccine are shown to reduce your chance of contracting COVID by more than 95%, okay? So it really reduces your chance of becoming infected. Because it's not 100%, almost no vaccine is 100%, and 95% is actually truly incredible. We actually consider vaccines huge success if they reduce your chance by 60%. So this is like an astonishing feat of human just brilliance that we're so grateful for. It's not perfect. There is a small chance of getting COVID, and there is a small chance of, if you do contract COVID, that you can spread it. We know that people who were vaccinated by COVID in general had extremely mild cases and protection against severe cases, which caused hospitalization or death, or ICU visits. Absolutely. If there's a chance that you could have a mild COVID infection, it does mean that you could transmit it, you could carry it and give it and spread it. That's why we really ask people to continue with their masking, their social distancing, their hand washing, and all of the things that you're doing already to keep yourself safe. Give me 1 second.
Yeah, so basically, just to carry forward Suzanne's point there, the answer to the question is that the vaccine doesn't 100% protect us from being an asymptomatic carrier of COVID. The good thing is it doesn't make it worse. It makes it better because the fact is that there's only a very small chance that you'll get COVID if you're vaccinated. Yeah. And if you do get it, you'll have not as bad a case. In terms of most vaccines actually have then reduced spread, though you could have a bad situation where the vaccine didn't actually have a high dose, like if only 20% of people that got the vaccine didn't get COVID. So your chance was still 80% of getting COVID, but you had less severe cases. That would be a very bad situation because we would just spread COVID around, right? Until everybody was immunized. In this case, it's very rare that you will get COVID after you're vaccinated. If you do get it, you'll have less symptoms, which is why we all need to stay socially distanced, masking and hand washing until we bend the curve of the second wave. It's actually really good to get vaccinated. One of the reasons I got vaccinated wasn't only for myself, it's because I don't want to spread COVID. So you're less likely to spread COVID if you have the vaccine, but you still have to practice, like as a healthcare provider, I have to wear personal protective equipment. And we send you home from the clinic. We try to send people home with masks and some hand sanitizer. I think we're a bit short on masks this week because we've been so busy. But yeah, it's just going to be really important for us all as a community to do what we can. But we are trying to prioritize vaccinating our elders and our community members that are living homeless, living rough, and living in bigger communal housing places or large apartment buildings, because these new variants. So one thing that's really cool, hi Zane, about the Pfizer vaccine is millions of people now around the world have been vaccinated with it. Most of the country of Israel has been vaccinated. So we are seeing studies there where people who are vaccinated, there's lower rates of spread among healthcare providers. Those aren't published studies yet. That's just observing. It's a big natural, what we call a natural experiment when a whole country is immunized. With the new variants, the good thing is Pfizer really does protect against severe disease with the new variants as well, particularly the UK variant. We're just learning as we see. But that's why we all have to be extra careful. So whether or not you're getting vaccinated right now, if you live in the city of Toronto, please be extra careful. I know it's been a year, 4 seasons of COVID, but this is probably the most important time to be very careful as we transition towards these new variants taking over. So all of the new variants are more contagious. So it's twice as easy to get the UK variant. So we may have gotten away with a little bit of visiting. We're able to manage spread in some of our shelters. It's going to be a lot harder to do that with this new variant. Okay, Suzanne, do you want to talk about some of the side effects, the immediate side effects? We talked about how there's not long-term side effects, but what are the most common side effects from getting the Pfizer vaccine?
So the number one most common side effect is sore arm. So soreness at injection site. It feels just a little bit stiff and a little bit kind of achy. That lasts for about 2 days, maybe 3 at most. If you absolutely have to take Tylenol or Advil for it, it's fine. You can take Tylenol or Advil as needed. I personally like to encourage people to fight through as much as they can. Some people get a headache, some people even get a migraine, some people feel very tired, they feel very brain foggy, just kind of run down. That's fantastic. I always think that having a side effect, it shows your immune system that it's working. It proves that the vaccine is helping and that you're actually responding to it in a good way. So it's actually positive to have some side effects afterwards. As much as, they're actually incredibly mild. And like Janet said, we've vaccinated thousands of people now and have seen very, very, very mild, mostly the sore arm. Extremely rarely, anything can happen to any vaccine. The biggest thing that we worry about is like a severe allergic reaction that we didn't expect or didn't see coming. Like Janet said already, there's very few potential allergens in this vaccine. It's latex free, it's anti-inflammatory free, there's no penicillin, there's no antibiotics. There's nothing that most people have an allergic reaction of an anaphylactic type to. So if you do have any history of having to take an EpiPen or having to be hospitalized because of an infection, we just need to know that in advance of your vaccination. And then we would sit and talk with you about what to do next. There is no medication whatsoever that we know of that interacts negatively with this vaccination. So no matter what medication you can take the vaccine. Some of them we just want to know about, so we can talk with you as well about that. Other than that, it really genuinely is an incredibly well-tolerated vaccine right now. I think, I can't think if I'm missing any side effects, really. Redness, soreness. There's something that's starting to emerge, and it's a delayed skin reaction that is not an allergic reaction that you should be worried about. So we're starting to see about 8 to 10 days after a vaccination, people are starting to get either like a bump or something that looks like a hive all around the vaccination site. That's okay. It's not harmful. It's not going to hurt you. You can show your doctor if you want to, or you can show the nurse or the nurse practitioner if you're worried about it. But it's not something that that is harmful to you or that is going to cause an allergic reaction for you. but it's just something.
Is that Moderna, or is it also Pfizer that you get that with?
Right now, they're just seeing it with, they're seeing it more with Moderna.
Yeah.
But but they are seeing it more with Moderna. Personally, I got no side effects whatsoever after my second vaccination, and that made me very sad. I really feel like I want a third vaccination so that I can get side effects and know that it worked. But really, I think that you'll find that it's really well tolerated.
Yeah. So with the Pfizer, for me, I always like the first needle was way easier than usually for me for a flu shot. It was just like it felt like a tiny little ant bite, and my arm wasn't even sore. For the second shot, you can get a bit more of a sore arm. I did get a bit more of a sore arm. I got some achy muscles. I felt a little more tired, and a little bit of stomach upset. But that was all gone within 36 hours. So, and then, like Suzanne said, I was kind of happy. I'm like, okay, at least my body. So those achy muscle things that you feel when you have a viral illness, that's because you're immune to gear and trying to fight it. So it's like, okay, well, that's a good thing. My body did make some antibodies the first time. Anyways, I was a little unpleasantly surprised, but I still worked the whole time, and it was all gone within 36 hours. I felt perfectly regular. So that's what we kind of hear about from most of the people. And Suzanne and I together have vaccinated thousands of people. She many more than me. Yeah, but around the world now, millions of people have had this Pfizer vaccine. Okay, any other questions coming out there? I guess we're looking on the chat. Feel free. Yeah, so great question that says, how many Indigenous people in Toronto have had the vaccine thus far? So interesting, like always, it's hard to always count us well in the city, but we know, I think Anishinaabe Health has done 2 or 3 clinics now. They're vaccinating 200 people at each of their clinics. And then through the Auduzhe clinics, we vaccinated about 300 people. So we still have a long way to go. It feels like we're under a little bit of pressure. But we're doing the best we can. People are working very long days. And then I do know, so for example, I heard at Michael Garron Hospital, you can just call, and they're immunizing all First Nations, Inuit, and Métis adults. And we are going to be working over the next couple of days, talking to Anishinaabe Health, and then the team at Auduzhe will try to put something out on social media. What we're doing at Auduzhe right now is we're working in partnership with all the other Indigenous and allied health and social service agencies that are part of TASK, and reaching out to those that aren't part of TASK. In that way, we're trying to work with other agencies and get them to help us to try to identify community members that they're aware of that use their services that might have some of the more bigger risk factors. So we're trying to focus on First Nations, Inuit, and Métis people who are age 55 and older. Those, as I mentioned, who are homeless or living rough or living in congregate settings or multi-generational crowded houses. And also those who have 2 or more chronic illnesses, and also those who are immunocompromised and who are pregnant. And then also those who live with those people, and also those who provide direct service provision to those people, including face-to-face care. Okay, so I think we have pretty well gone through the whole Ministry of Health info sheet. It says, can you get COVID from the vaccine? I think we've made it pretty clear that you can't. What measures have been put in place to safely provide immunizations during COVID? So of course, at Auduzhe, we've been doing COVID testing, right? So when you come to the clinic, please wear a mask. We'll give you a clean mask. Everybody still has to socially distance at the clinic. We ask people to wait for 15 minutes after their vaccine, just to make sure you don't have one of those immediate allergic reactions, which are called anaphylactic reactions that Suzanne mentioned, the kind that you need an EpiPen for. And then you'll see Suzanne and I will be dressed up a little bit like space people, I guess, but actually because we ask people, if you do have symptoms of COVID, please don't come to the clinic, especially because there could be elders or other people. Give us a call. We can reschedule your vaccine appointment. I guess we, at the vaccine clinics overall, the risk is probably a bit less than when we're at the COVID testing clinics. But yeah, I tend to wear a shirt that I change when I get home. And then of course we have our own masks on, and then the face shields when we're interacting with people. So a little bit, more that we still have to wear those masks, I guess, say, Suzanne, and we ask everybody to keep their mask on when they're in the clinic.
And I think that raises a good point that Janet mentioned. If you've had COVID or think you've had COVID, you can still get vaccinated. We just don't want you in the clinic when you might be infectious because other people are going to be there. So what we would do is either offer you testing or wait for your symptoms to get better. If you've had COVID, you might have a strong reaction on your first injection, on your first vaccination dose. And that might just be because your body is already primed to remember that spike protein. So people who have a much stronger reaction, I often wonder if they've had COVID in the past. Other than that, everybody makes a different amount of natural immunity. Some people might make no immunity, some people like antibodies. It might be linked to how severe your case of COVID was, people who are asymptomatic, people versus severely symptomatic. So we just tell everybody, even if you've had COVID, come and get your vaccination once you feel better and once you're cleared from a public health standpoint and you're off your quarantine isolation period.
Great. Okay. So I think that we have covered most of the information about the vaccination. There is the question on the consent form asking too if you've ever fainted or felt faint from immunization or medical procedure. That's just to help us know that, so we don't get you to stand up suddenly from your chair. So basically, the COVID-19 vaccine screening and consent form, and I'll put up in the chat where you can find that as well. But basically, it's pretty straightforward. It just asks if you have symptoms of COVID-19 or feel ill, because if you do have symptoms of COVID-19, we won't give you the vaccine on that day because it'll distract your body from fighting. It's too late to help you. But if you have had COVID, definitely do come in for the vaccine, because we can make sure that you're immune, because you can get COVID twice. And then it asked if you've had a severe allergic reaction to previous COVID mRNA vaccine or any of its components or its container. And again, most people will say no because they haven't had a COVID vaccine before yet. I guess that question might be good for next year. And then that's when we ask then the next one, do you have a suspected hypersensitivity or immediate allergic reaction? Those are those anaphylactic ones to the COVID vaccine, polyethylene glycol, and then there's polysorbate, which is something that's kind of related to polyethylene glycol, but it's not in the vaccine. But if you have that, then you might have a reaction to polyethylene glycol. Those things you might have been exposed to too if you've ever had bowel surgery or a colonoscopy. They're in the medicines that clean out our bowels before we have those things. And then have you ever felt faint after a past vaccination or medical procedure? And then any other severe or immediate allergies. So most of the questions all focus on this anaphylaxis. We go through it together. If, as Suzanne said, the good thing is, like, I'm allergic to latex, but I don't have to worry about that with the COVID vaccine. So most of the things that we're commonly allergic to in drugs are not in the COVID vaccine. And then it asks those other questions we said, another vaccine in the past 14 days. And that is, if you have, then you would have to wait till it was 14 days after. But could you be pregnant or breastfeeding? And again, that doesn't mean you can't have the vaccine. It's just so we're aware and we can discuss it and help you make full and informed decision. And then any problems with your immune system, autoimmune disease, and bleeding disorder. And again, those aren't contraindications. It's just so that we know and we can talk about it. And in fact, if you have an immune disorder, it could actually be more important that you get the vaccine. Again, that's one of the priority groups. And then you can consent to receiving the vaccine. And then there's a little section of the form about acknowledging that the Ministry of Health is collecting your personal health information about getting the vaccine, because they have a provincial system called COVAX, but they won't be able to release your name to anybody. That would be illegal for them. But they are tracking who gets their vaccine in the province. And then you can say yes or no to being contacted about research studies. And you do not have to agree to be contacted about research studies. As some of you know, at the Auduzhe Mino Nesewinong Clinic, we're doing something called We Count COVID. So if people have had COVID or at risk of COVID and are getting tested, you can participate in that. But at this time, we're not asking people to participate in We Count COVID at our vaccine clinics, because our objective is to provide as much vaccine as we can to the 80,000 Indigenous people in Toronto in a culturally safe manner through visiting and movement. So we don't want to be asking about the We Count COVID study, because that would slow us down a little bit. But we find we're vaccinating. We vaccinated 132 people last Tuesday, and we have clinics coming up this week. So yeah, you can give us a call. Someone said a really good question here about, do we have a map? So we don't have a map yet. We can work on one. The Auduzhe Clinic is at 22 Vaughan Road, so that's near Bathurst and St. Clair. I know Anishinaabe Health has had a couple of clinics at their Gerrard site, and then they also have their mobile RV. And then some of the hospitals are actually also opening their doors to vaccinate First Nations, Inuit, and Métis people. So we're this is all gearing up very quickly. One other thing to know about us at the Auduzhe Clinic is if you need help, we can help out with getting you a taxi for back and forth from the clinic. We're asking the agencies, the partner agencies that we're working with, to help arrange those as well. But Beck Taxi has a COVID-19 squad. So we figured that would be the best way to protect everybody rather than get our own bus and put people together, because they clean the taxis. The taxi drivers are aware, and they have that glass partition between the driver and yourself. So that's what we're using right now for transportation. So if you are, who should we call if we're interested in getting vaccinated and living in central downtown Toronto? So you could call us at the Auduzhe Clinic. I don't know, Jen, if you can maybe put our clinic number in the chat box there, and on Facebook. If you are affiliated with any, like Anishinaabe Health Toronto or Council Fire or Native Women's Resource Center, any of the downtown agencies, Native Canadian Center, you could give them a call as well. Right now, we're just gearing up to have the capacity to directly respond to direct referrals from our phone line. But most of the vaccinations we're doing right now are done in partnership with some of the other agencies. Suzanne, any last words?
Yeah, I was just going to say that it seems complicated the way that the bookings are done, but it's at this moment it's so fragile, and the vaccine is not long lasting. So we really try and make sure that every dose we open we use, and having no wasted doses is one of the most important goals of our clinic days. So we will definitely do our best to not turn away walk-ins, to not turn away people that arrive. But if we can get organized through our task partnerships and through the other Indigenous agencies, it's always a better way for now while we start ramping up this vaccine for our community.
Yeah, it's just mostly a matter of capacity, because we just pivoted from like being a testing site to giving vaccines literally in a period of weeks. So we don't have like anybody full-time staffing the phones. And then the other thing is because we're trying to make sure that we're prioritizing those who are most at risk from getting COVID. So that does mean, yeah, if you got a stable place to live and you're a little bit younger, you might have to wait a little while, but we'll get there. Be patient with us. Yeah, we have been able to, we're working hard on accommodating people. Okay.
I can answer that last question, unless Janet.
Yeah.
No problem.
Go ahead, Suzanne. No problem at all with estrogen and testosterone.
Yeah.
Yeah, you certainly can. And we've had trans people into the clinic and we've been vaccinating them.
There really is no medication that you should be worried about. There's no medication, there's no substance, there's no prescription or otherwise medication or drugs that will make it a contraindication for you to get the COVID vaccine if you want. I know that there's a lot of people that are on various medications or use various substances or have anything. It's all okay. Okay.
Yeah, I was just looking for our phone number at Auduzhe, but you have it, Suzanne?
Put it in chat.
Oh, she's putting it in the chat. That's good.
Is there more questions? I feel like there's got to be more questions. I always like people to tell me the stories.
Yeah, it's hard a bit because we're just here on Zoom, the two of us having a visit. Yeah, so we answered the questions. Oh, here we go. For the few people who were vaccinated and got asymptomatic or mild illness, how were their lung scans later in terms of looking like a smoker around glass opacities? So, yeah, with the Pfizer and biotech or Moderna vaccine, I've never heard of anybody having any changes in their lung scans. So I'd be interested where that came from, but that is not, that would be a very serious side effect, eh, Suzanne?
Yeah, that would be a very serious.
But it is like one of the things that's hard is people who, like so many people are getting vaccinated, millions of people are getting vaccinated. Out of that large population, people could just get a different illness. And of all the different people that are getting vaccinated, some of them might have come in, like with some baseline problems with their breathing or their lungs, and it would be very important to vaccinate them. But this vaccination, does not cause your lungs to turn into smoker lungs or have ground glass opacities. Yeah, I don't know where that came from. People could get things that cause their lungs to deteriorate. Okay, so I think we're going to wrap it up. We'll wait for a minute. I know, so there's our number, 416-654-4184. You can call and leave a message, and we will try to get back to you. Bear with us as we work together with all of you to try to get us vaccinated. Yeah, some folks are worried that we're lab rats, guinea pigs. Is that true? I don't think so, because these vaccines, the Pfizer vaccine was tested in like hundreds of thousands of people before it got put into use. The original study in the New England Journal of Medicine, I think there was 30,000, 25 to 30,000 in each group. So actually there's been a lot of people, including Indigenous leaders from different backgrounds, who have advocated to try to make sure First Nations, Inuit, and Métis people get near the front of the line, not because we're guinea pigs, but because, of course, we've had some embodiment of 500 years of colonization, right? So we know that we can be more susceptible to these kind of illnesses, partly because more often we're living in crowded or substandard housing conditions, and then unfortunately because we have a heavier burden of chronic diseases like diabetes or being big. So those are breathing problems. Those are all things that can make outcomes with COVID worse. So yeah, I don't think so, but we have reasons to be afraid, like of medicine. Medicine has used us as guinea pigs and harmed us in the past, which is why we think it's really important to do this kind of work, these kind of sessions, and try to set up our own community services. So it's by the people for the people. So then we're not lab rats anymore. We're our own community members, we're sacred beings, and we're trying to help each other. Okay, Suzanne, any last words before we say goodnight?
No, thank you so much for spending this evening with us. I know it's the All-Star game, so just joking.
I didn't see that.
It will be soon. No, I really appreciate it. We're always here. You know, if you want to come and just talk to us and ask questions, we can also do that as well. Give us a call, reach out. I'm more than happy to chat with anyone that has wonders or questions. Or yeah, I'm very happy to be here for the community, and I'm really happy to be here to be able to start, you know, creating these bigger and bigger spaces of healthy breathing where we can start to be together again. So thank you.
Yeah, thanks everyone. And thanks for the awesome questions too. There's no silly question, and asking all those questions is really helpful to others too, because I think this one's been recorded. So your questions are really helpful because I'm sure others have similar questions. In the sessions I've done, many have asked similar questions. So I hope everybody has a good night. Stay safe. The sun is coming. Summer is coming. It's going to be a better summer. But yeah, we still have a couple tricky little obstacles to get through in terms of waiting for this new variant that's more contagious to yeah, emerge. So yeah, try if you can to keeping on, stay safe, stay well, and we'll talk again. Night, everyone.
Night, guys. Thank you.